Matt, the risk of catching any serious viral infection on board an aircraft is very low. First of all, think about the air supply to the aircraft, which is highly purified. So modern aircraft use a mixture of 50% fresh air and 50% recycled. The recycled goes through HEPA filters of exactly the same type that we use in surgical operating theatres. So what comes through the air supply is very pure. The risk that remains is if you are close to somebody who's unwell at the time, because we know that this virus has spread in the vast majority of cases through close contact with somebody who's unwell at the time. So that risk is what remains, and there are simple things you can do to reduce that risk, of course. But through the air supply, the risk is low.
What can people do then? You mentioned some of those simple things. What can people do to protect themselves? Those people that perhaps are watching this and are about to travel on some sort of international flight, worried about perhaps contracting the virus on board a passenger aircraft. What are some of the simple tips from your point of view?
Well, this is advice that we've promulgated long since before this outbreak, and it hasn't really changed. Respiratory viruses transmit mostly by droplet spread, which is coughing or sneezing upon somebody, or in some cases by fomite spread, which means that you contaminate a surface which another person then immediately touches. So surprisingly enough, hand hygiene is the primary thing. So it's avoiding touching your face. It's frequently washing and drying your hands, or if you can't do that, then using hand sanitizer, alcohol-based. And particularly if you've been touching your face. It's cough etiquette, so coughing into a tissue or sneezing into a tissue. And if you can't do that, then cough into your elbow, and then immediately again clean hands. And of course, not flying when you are yourself unwell. If somebody nearby you is unwell on the aircraft, then you should bring that to the attention of the crew, because there are established procedures that they can take to separate that person and minimise risk to others.
You also say that wearing masks, face masks, can actually be fairly ineffective. I'm, of course, here in Singapore, where pretty much every other person on the street is wearing a face mask right now. Why is that? Explain that to us.
Well, face masks are a reasonable protection when given to a sick person to wear to stop their droplets from spreading to others. But as a passive means of wearing casually, the WHO has reiterated on its public information that that's an ineffective protection. And they advise that if you're healthy, you only need to wear a mask if you're actually caring for somebody who's unwell, and also to wear a mask if you're coughing and sneezing yourself. And if you have to do that, they also emphasise the importance of hand hygiene once again.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.